Our next recipient of the Sadguru Humanitarian Award is the Aravind Eye Care System, Madurai. A round of applause for them. Much has been written and said about the founder of Aravind Eye Care System, late Dr. G. Venkatasamy. With due apologies to the great scientist Albert Einstein, I suffice it to say that a generation to come will scarcely believe that such a man as Dr. G ever in flesh and blood walked upon the global ophthalmic firmament. It is today. Dr. P. Namperumalsamy, who is the Chairman Emeritus of Aravind Eye Hospital, a founder member of the Gopal Trust, which runs Aravind Eye Hospital and Postgraduate Institute of Ophthalmology. A brief about Aravind Eye Care Systems. Aravind Eye Hospital, which began as a modest 11-bed center in 1976 with a mission to eliminate needless blindness by providing quality, compassionate and affordable eye care to all, encompasses today a network of 10 hospitals, 54 telemedicine-assisted village vision centers, 6 community centers, a manufacturing center for ophthalmic products, Orolab, and a consultancy and training institute for community ophthalmology, LICO. Aravind has handled more than 45 million outpatient visits and performed 5.6 million sight-restoring surgeries since its inception. A louder applause, please. Among these beneficiaries, 60% of them get free or highly subsidized treatment, and only 40% pay for the services. That's the official version. But to all of us, the Aravind Eye Care System, or just Aravind Hospital, means a lot more. They were the first to begin in modern management techniques in mass-based community programs, mass-based community programs, thus rendering them cost-effective. In a self-sustainable manner, the AECS system has risen to the skies of an international role model. They made eye care accessible, affordable, and accountable with their periodic self-auditing systems. To mention the next member in the team, as we say, behind every successful man is another successful woman. Dr. D. Natchiar, her condensed CV runs into double-digit pages. I shall highlight only a few of her shining achievements in ophthalmology. A pioneer in neuro-ophthalmology in India, who went on to a fellowship in ophthalmic pathology and neuro-ophthalmology at Harvard. At Aravind Eye Care Systems, she put in a system of systematic teaching medical HR administration. Her reigning mantra in 90s was, first she would cause and learn, and then teach new concepts. She has penned books on neuro-ophthalmology, pediatric ophthalmology, and SICS. She is a director emeritus at AECS. She has been felicitated by various state societies, Rotary and Lion Clubs, IMA, and the likes. What stands out is the Doctor of Science conferred upon her by the MGR University, Chennai, and the Lifetime Achievement Award from the Center for Sight, New Delhi. According to her last shared resumes, she has 43 publications, an equal number of presentations, chapters in 9 books, and 5 textbooks to her credit. She is the quintessential teacher of teachers. Though she has now achieved superannuation, all the students reminisce her with fondness and gratitude. She has now transferred her passion to organic farming. She now supplies nice vegetables, rice, vegetables, and fruits to Aravind Eye Care System. I salute the empowered Nari Shakti here. Belated Happy Women's Day, ma'am. A seed that was sown by Dr. G. Venkateswamy, has now transformed into a banyan tree, in her words, that offers shade to all that draw towards its magnificence. The man who stood by Aravind Eye Care Systems, I would now like to mention the contribution of Mr. Govind Srinivasan. Sir has been with the system since its time. A civil engineer by profession, Dr. V's right hand by choice, currently president of Gopal Trust that runs Aravind Eye Care Systems and also that of the Oro Labs Trust. Needless to say, he epitomizes the ethical, moral, and cultural ethos of Dr. V. Ladies and gentlemen, I give you Dr. V. Srinivasan. He has been awarded the Vishveshwaraya Eminent Engineer Award for the year 2011 by Association of Consulting Civil Engineers India, Madurai Centers. However, very few people know that he is the financial genius who is responsible for the self-sustainable Aravind Eye Care Systems model. Be it computer digitalization, administration, structural design, interiors, or anything outside of clinical ophthalmology, Mr. S has played a pioneering role in it. A quiet, self-effacing man of many talents who has chosen to remain in the background and let others bask in the limelight. Today, I request you to put your hands together for this non-ophthalmic genius who has played a magnanimous role in what Aravind Eye Care Systems is today. I now invite Dr. Nam to please share more light on the journey of Aravind Eye Care here. Dr. Nam.
The chairman, the medical director of Shri Sadguru Seva Sangh Trust, the members and the dais, delegates of this prestigious workshop, and first let me congratulate the trust for celebrating this 50 years of the growth which has gone up, which we have seen with our own eyes, the progress that is made. And also you saw the journey of Seva Sangh Trust, which is marvelous, excellent, not only in the health, but also in agriculture or dairy farms or everything, which is a standing example of uplifting of the rural community. Now, when I say the rural community, I am also from the rural community because I have been asked to present journey of Dr. Namperumalsamy, journey of Aravind Eye Care System, and the partnership of Aravind Eye Care System with Sadguru Seva. That is what I have been asked. So, I am from a rural village, a modest family. What you see is my village, my home from which I was born. Also, you can see the school from which I have come from. The school, that is my parents are responsible for making me the medical person, but I owe a great deal for my brother-in-law, the founder of Aravind system, who made me the ophthalmologist. 1966, I became the ophthalmologist under his care. But my journey as a vitreoretinal surgeon, it was not planned one. First, I was just a low vision aid ophthalmologist for 2-3 years. And yet, once it happened, a chain of events was set in motion that would profoundly affect the delivery of the eye care system. That is what it happened was. In 1967, when we met Dr. Goldberg, he was the director of University of Illinois, Chicago, he invited me to spend 2 years of fellowship at Chicago, the first diabetic retinopathy study program associated with National Eye Institute. That was the beginning of my journey into retina, which is medical retina, and diabetic retinopathy in particular in 1972-73. And that was the beginning when myself and my wife Natchiar went to Chicago to undergo that. That is the time from which we started going around the country, familiarizing this indirect ophthalmoscopy, Dr. Badrinath, Dr. Nagpal, Dr. Patnaik, and that is a small group of people who popularized the indirect ophthalmoscopy. What a stethoscope for a physician, an indirect ophthalmoscopy for any ophthalmologist, leave alone the retina vitreous surgeon. That was the emphasis which we used to make all over the country. It made the revolution in ophthalmic science. That is the that is the contribution which we say, the basic thing which has come up. Also, when I was doing my fellowship, that my role was to compare the xenon arc photocoagulation and the laser in 1972-73. When I finished my fellowship, I carried this xenon arc photocoagulator with me as my company luggage in 1973. The first one to come into the country, the xenon arc photocoagulator. That is a portable one, Clinitex. Not even patent was pending at that time. I think this Shukla is there laughing because he has used it. Dr. Prasad Das was my first fellow. He has used it. And that was the time we had the xenon photocoagulation popular for diabetic retinopathy and in India. That in 1974, after coming over here, the first clinical vitrectomy was done at Government Rajaji Hospital, of which I was one of the faculty there. A vitrectomy machine was brought by no other than Dr. Golam Payman. He was made the honorary member of All India Ophthalmological Society after that time. He came with the machine and left the machine with us at Aravind, and we started giving the continuing medical education program, CME program, the first of its kind in the country. All the leading surgeons here have attended that CME programs from that time onwards, 1974, the vitrectomy. And that is the time even the intravitreal injection of for endophthalmitis, gentamicin with dexamethasone was started. Intravitreal injection was started for endophthalmitis in 1974. So first time it was done that. My surgical retina fellowship started in 1977-78 under no other than Dr. Charles Kippens at Mass Eye and Ear and Peripheral Retina Foundation. Just like my previous 2 years before, Dr. Badrinath was the fellow, but I started fellowship later. And I was selected during an eye camp here in India when he visited here as a visiting surgeon. And when I showed my interest to do the surgical fellowship, he said, yes, I have seen you, I have interviewed you in doing surgery, so you are selected. That was the time he was, and did fellowship in Boston for 2 years and familiarized all this surgical. When I came back, there was the system was ready with the Aravind Eye Care system, the Gopal Trust. At that time, it was only Aravind Eye Care. I was one of the founding members, along with Dr. Venkatasamy. We started this foundation in the humble 11-bedded hospital in 1976, with only a handful of people, with a nursing staff of the village girls joined us to help us during the surgery and other. With 11 beds in a rented building, and that was the beginning, but now it has expanded to 6 major hospitals, tertiary care hospitals, 6 secondary care hospitals with surgeons, with surgery, facilities for doing surgery, 6 comprehensive eye examination treatment outpatient centers, and 66 vision centers, all these things within the Tamil Nadu state, except one in Pondicherry state, we have these centers established. It all happened because of honest, hard work, with not only with the doctors, but also working with the community, working for the community. That is the reason why we could succeed in this way. And you can see we are seeing about 13,000 outpatients per day, even now. But in addition to the hospitals, we have also developed the management system, Lions Aravind Institute of Community Ophthalmology, where we can train the managers and administrators. Outreach camps, we can, instead of patients coming to the hospital, we go out and treat the patients in eye camps, which has already been pointed out. And also the training scheme for postgraduates, residency programs, MS and DNBs and DBOs, and fellowship programs in all the specialties were started in order to address the challenges of mass surgery, because we need HR, the human resources, we cannot search for the people from outside, but we train our own, the postgraduates, not only ophthalmology, but also values and culture of Aravind Eye Care system, to work with the community, commitment to the community, and their responsibility to the community. We all teach that so that they can work not just ophthalmology, but Aravind system. Aravind works on 4 models. One is the service model with a large volume, high quality, and sustainable, affordable, self-supporting. We are bold to say that we are self-supporting. We have not borrowed money from anywhere. We make our own money and then we expand. That is the first thing. And it is called a social commitment, the business model. This is also, and innovations. Innovations, as we go along, the bottom of the pyramid, CK Prahalad's bottom of the pyramid is the lowest cadre. They don't have any money to give. Apex, they are only 5% of the people they can. If we concentrate in the middle, and if we work on them, there is enough money. And that is how we started with that. Community-based eye care with modern technology, quality, affordable to all, financially viable. And this is the model we preached. This is the model we established. And this is the eye camps. We do outreach activities. At least 2,600 camps per year we do every year, out of which at least 100,000 surgeries are done totally free of cost. And in spite of all these things, people don't come to you. Only 7% of the people take advantage of the eye camps. The rest of 93% of the people, those who have got vision impairment, still they don't. So what we thought as conceived an idea, believed it, and we achieved it, what we call primary eye care center. Now it is called the vision centers. And we conceived with the information technology oriented, and this we did it in the village where I was born. The first center was started in 2004, and the only center which was inaugurated by Dr. Venkatasamy. That is the other centers. And these are managed by 2 trained technicians, and they do all the investigations, and then I will come to that. And it is connected with the internet. Information will go to the major center, basic hospital. Although you can see Dr. V is just playing with that equipment. What he says, he can converse with the doctor in the base hospital. And this is the vision center. This is the first center he inaugurated it. And this is the vision center you can see here. Not only the patient walks in, he is examined, images are taken, not only the images outside image, but also every vision center, 66 vision centers are connected with they are having the fundus cameras connected to the internet. Images are sent to the base hospital, and the results are known and sent to the doctor at the center immediately, so that the patients can be referred, and the doctors can converse with every doctor every patient who attends the vision center will converse with the doctor with the base eye. So this is what the advanced model of, and if the patient needs glasses, the glasses are made on the spot and given. So the money which they spend by going by bus and other things, they can buy the glasses itself for the eye care. And that is the thing which is being carried out in 66 vision centers. 2,000 teleconsultations are done every day with all our 5 doctors. This is what this. In 1996, Director V said formally handed over as directorship, and I acted as a chief medical officer, a director, or a chairman, or a vice chairman, everything until 2010. And under this, not only in order to support these activities, we had to do our own teaching and training. We have the MS ophthalmology and the diploma in ophthalmology. 15% of all the ophthalmologists in the country, I see most of the people also trained with us in India. The 15 ophthalmologists are trained with Aravind eye care system. And also, not only that, we also train people through telemedicine, ophthalmology network. All our hospitals are connected by tele-ophthalmology. All our grand rounds are CME are taught. The faculty from one side can teach all the postgraduates in all our centers. And not only that, we also connect with Aravind Wilmer grand rounds. Every month we have connection with LVPA also, with the Retina Consult, Retina Division. We have so this being connected, so dissemination, sharing information, dissemination of our knowledge is done with Aravind. And training of fellows, the specialty training was very, very meager down in India. So we started training fellows. The first training was in intraocular lens training. The second was in retina. The first retina fellow is sitting there in front of you, Dr. T.P. Das. Just like that, you have got very many retina doctors are heading the departments in the country, and they have got their own retina. A handful of people only retina at that time in 1974. But now there are, thanks to you, thanks to the trainees right now, even Sadguru now has got the CME programs that we could make so many retina surgeons here. Centers of excellence, because we have to train our own people, and our strength is in the 80% of our employees are women. Today is Women's Day. Okay. 80% of our employees are women force. Most of them are school final girls. They are taken on the job, get trained, not only in giving all unskilled work that being done by them. And instead of hiring doctors, we hire these people, and they do most of the job. In that way, our productivity and efficiency goes up. Instead of doing 400 surgeries per year, each doctor will be able to do 2,000 surgeries per year. In that way, we can increase the productivity by each doctor having 3 or 4 assistants. That is another innovation which we have made. We must possible. So we have done around, you can see here, last year with 5.9 million surgeries have been. It is about 48% of the whole Tamil Nadu vision surgeries being done in the Tamil Nadu. And it's about 4.8% of the entire countries. That is what it is important is. And the quality is not compromised with the volume of the done which we have done. Everything monitoring is being done. Quality council is being done, monitored every month or every 2 months with high volume. Service is given. 35% of the people only will pay. 65% of them are highly subsidized. Or this, in spite of everything, Aravind Eye System makes money with due policy by our finance man, me. So we still make all the physical expansions and up-to-date technology, state-of-the-art, everything is being done with the money earned from Aravind Eye System locally with us, not by any donations. And this system is propagated through Lions Aravind Institute of Ophthalmology, sharing of experience, and our sharing of experience is with Sadguru. You can see here, Sadguru is one of the thing we have been working with them, what we call capacity building, and we call them and they come and then we go there and so this is in 2000, if I am correct, yes. I initiated the mentoring process. Aravind model is being disseminated to other parts of the country as well as other parts of the world, and this is what is we have been you can see here Jane here, there 2000. So this is what our relationship has been, and they have shown the improvement, the performance has increased. What I think you have already been hearing it from 20 years ago. You can see here there are about 50 plus full-time ophthalmologists now. More than 90%. So the HR has increased and the performance has increased. 99% are intraocular lenses. All these things, quality, everything. But they have exceeded what we have taught. That is the most important thing. They have improved upon the services by Aravind Eye System. I must congratulate the whole team doing it. More than anything else, I just want to pass on one message that is essential for every ophthalmologist. I am always fascinated about the diabetic retinopathy because I said 72, 73 itself I have been forced into the field of diabetic retinopathy. So this is nothing but take one idea and make that one idea your own life. Think of it, do it, dream of it, live on that idea. That is Swami Vivekananda. So what we thought was blindness due to diabetic retinopathy is preventable. Diabetic retinopathy need not be, but blindness due to if proper care is taken. That is how we thought a diabetic retinopathy model was set out as early as 1980s, starting from awareness creation, outreach camps, and the product development of indigenous laser development was made. All these things are a thing. And also we did a mobile van, which goes to the villages with the satellite connectivity, internet connectivity. The fundus camera is there inside the van, and patient walks in, technician takes the fundus pictures, sends the image to the base hospital, and the doctor reads it, sends the image report back, and then the patient knows that whether he has diabetic retinopathy or not. If he has, then he has to go refer to that. That mobile van, this technology was developed and being propagated elsewhere. In addition to that, we have developed the RO lab, which everybody is familiar, and we have developed the indigenous laser part of it, but more important, the medicines, pharmaceuticals, not developed by other pharmacies because of loss of the profit is not that much. Retinal products, I think retina surgeons will appreciate PFCL or silicone oil or everything which is not manufactured by other companies were made possible by this RO lab, which we introduced because we were the people who have been promoting, and that is the most important thing. Role models, you should have your own role models. This is my role model, the first role model, Dr. V, and the second, the Dr. Goldberg and all those things we can see. But more than that, you must develop your contacts, long-time contacts, people who have been teaching you best figures in this. That's what you have to do. And I must tell you that I told you that you must, so that like institution like this one should concentrate on the research part of it to prevent blindness. Facilities are there, faculty is there, scientists are available. If they can ask questions, and they will be able to do. And I can see the best example is Chandigarh, Amod Gupta, which is the best person indicate that research, he can do that. So all these things have been possible by one man's vision, Dr. B. He has shown the way, and he has set the goal. If the goal is reached, that means we have not set the goal right. We have not set, so we have to set the goal and aim high. And that will be the goal. And that is how Aravind has made a journey. And my journey was a part of that. Thank you very much.
May I call upon the stage Dr. G. Natchiar and Mr. Govindappa Srinivasan to join Padma Shri Dr. P. Namperumalsamy to receive the Sadguru Humanitarian Award from Vishad Bhai, Dr. Jain and Mr. Raghunath. Please put your hands together, ladies and gentlemen. A round of applause, ladies and gentlemen, once again.
I just wanted to, I'm really honored, very honored, Dr. Jain and Mafatlal Group and all the employees of Sadguru Hospital. You've gone way high up, way high up. And we are so proud to be associated with you. And we were taking only the eye care as part of our work because we were professional ophthalmologists. But as Maharaj, with blessings, taking care of the entire humanitarian development. And Mr. Mafatlal family, I think you should also be honored to come under this noble service, and you should continue as a grandson, and your own children and grandchildren should continue this noble work. And thank you very much for giving this opportunity. It's a great, great work. Thank you.